Hello, in this section we're going to discuss the form and function of the periodontium. Periodontium is defined as a set of two supporting tissues, including the cementum, periodontal ligament, alveolar bone, and gingiva. In this image, we can visualize these structures in place. It demonstrates the periodontal ligament, which is the thin structure attaching the tooth to the bone. You can see the cross-section of the gingival tissues, the root and the crown of the tooth. When describing gingiva or gums, the dentist will use four terms to communicate his or her findings: terms of color, contour, texture, and consistency. Let's describe texture and consistency. The texture is the surface characteristics. Healthy gums generally have stippled appearance, similar to a peel of an orange, and consistency refers to the resiliency. Healthy gums are usually very resilient, as opposed to gums which are inflamed, which are rather edematous. In Caucasian, the color is generally coral pink, but deposits of melanin render it darker depending on the racial background of the individual. This image demonstrates the color of gums in an African American male, demonstrating the melanin pigments accounting for the dark colors. Variations in color and texture are also important in differentiating healthy from unhealthy gingiva. In these images, the very top slide demonstrates healthy gingiva, where the tissues are stippled, coral pink, and firm, as opposed to the slide demonstrating periodontitis, where gingiva are rather bluish, dark, and there is suppuration from the pockets. The gingival margin is the most coronal part of the gingiva, and it parallels to the border between the crown and the root of the tooth. At times, due to intrinsic factors such as excessive abrasion or disease, the gingival margin recedes apically. When this happens, gum recession takes place. This particular image demonstrates gum recession, causing exposed root surfaces, which can lead to thermal sensitivity. The gum tissue between the two teeth is referred to as the interdental papilla. It is usually triangular and covers completely the interproximal space. In health, it is usually flat and covers the interproximal space completely. However, in teeth where there are spaces, large spaces exist, that interdental papilla may be slightly blunted, such as this slide demonstrates. There are two sets of papilla. There is the facial papilla and the lingual papilla on the lingual side, and the area connecting the two papilla is known as the interdental caul. The interdental caul has significance in health and disease because this is the area which is most susceptible to inflammation. Caul is the most concave in posterior area of the mouth, and if the patient does not floss their teeth, plaque accumulates, leading to bleeding and inflammation in those caul areas. The gingiva are composed of keratinized and non-keratinized gingiva. The keratinized gingiva has a layer of keratin, which results in a paler color, and the differentiating area between the keratinized and non-keratinized tissue is the mucogingival junction. Periodontal ligament is that structure which attaches the root of the tooth into the bone. It consists of a layer of soft connective tissue which covers the root of the tooth. It attaches the root to the bone of the tooth socket. It is composed mainly of fiber bundles. The fibers attach on one side to the cementum and on the other side to the alveolar bone. The entire periodontal ligament is only 0.2 millimeters thick, yet it is a very efficient structure as it holds the teeth firmly in the jaw socket. There are several functions of periodontal ligament. It offers support because it suspends and maintains the tooth in its socket. It has a sensory function as it provides sensory feeling to the tooth, pressure and pain sensation. It has a nutritive function because it provides nutrients through cementum and bone. It has a formative function as it builds and maintains cementum and the alveolar bone on the tooth socket. And it also has a resorptive function. It can remodel the alveolar bone in response to pressure or tension. The alveolar bone forms the bony sockets that provide support and protection for the roots of the teeth. That bone develops when the teeth erupt. However, when the teeth are extracted, the alveolar bone resorbs. This is something that's not understood by many patients who opt to have full dentures. The denture initially may be well-fitting, but over the years, as the bone resorbs due to lack of the teeth, the denture has to be completely, constantly realigned. Significant ridge resorption can make it difficult to utilize traditional dentures as they rely on alveolar bone support. This image demonstrates the alveolar process which holds the teeth in place, and you will notice that there are two types of bone: the cortical plate, which is the compact bone which forms the outer layer, and the cancellous bone known as the spongiosa, which forms the bulk of the bone.